In our health alert tonight, we are smack dab in the middle of cold and flu season, and it turns out common cold medicines might be putting you at risk for heart attacks and stroke.
Our chief health editor, Dr. Nandi, joins us now with how the meds can actually affect our heart. Doctor?
Alan, so winter colds are definitely circulating, as you know, and making lots of folks feel absolutely miserable, and nobody wants to constantly cough, sneeze, or blow their nose all day long. But before you reach out for relief, it's important to know that some common cold and flu medications contain decongestants and NSAIDs, which are also called non-steroidal anti-inflammatory drugs. So how could these affect your heart? Well, the American Heart Association states that these drugs could increase your blood pressure, and this could be dangerous for those folks who have high, uncontrolled blood pressure and heart disease, because it could potentially raise the risk of a heart attack.
So how do they raise your blood pressure?
So Glenda, when you take a decongestant like pseudoephedrine or phenylephrine, their job is to do what? To constrict these blood vessels so less fluid gets in and clogs up your sinuses. Now this may provide some relief. However, constricting these blood vessels can also increase your blood pressure and your heart rate as well. And the concern is not just for those folks with heart disease and cardiovascular disease. Research has found that roughly 5% of people who were considered healthy ended up with higher blood pressure when taking these drugs. So important stuff there.
Yeah, for sure. So doctor, what are some other options to consider?
So there are other options out there, Alan, and you can try oral antihistamines, a decongestant nasal spray, for example, nasal saline, or medications that contain acetaminophen, also called Tylenol. Now, if your symptoms are mild, I'd suggest you try to avoid medications altogether and get plenty of rest and fluids. That can really help with body aches and clearing out mucus. But if you really feel bad and feel like the need to take decongestants or NSAIDs, I'd recommend you speak to your doctor first. And remember, as I often say, the best way to stay healthy, and avoid getting sick, and that is to wash your hands, right? At least 20 seconds. Please do this often with just soap and water and try to get through the season.
Does the same go for allergy medicine, Doc?
You know, those are mostly antihistamines,
Okay.
right? So less decongestants. These are decongestants and NSAIDs, and that's what we worry about, raising the blood pressure, increasing your risk of heart disease.
Thank you so much, Dr. Nandi. We appreciate you. If you have a question or health concern for the good doctor, email him, Dr. Nandi at askdrnandi.com, or send it to us, Facebook or Twitter. We'll get it right to him.